Here's what's important to tell patients about that. They should not take it for more than 4 to 6 weeks. It is not meant to be a long-term therapy. If they're taking it, and really, just between you and I, that's what your book says, but I'm going to tell you. People should not be taking Zantac really more than 2 to 4 weeks. And if they're still having these terrible stomach problems, they need to be in touch with a physician. Megan.
I have a dumb question. For antacid, what qualifies as a high sodium level? I mean, what's the norm?
So the norm would be based on what a normal dietary intake, a daily intake of sodium is. And so if I recall off the top of my head, you guys can correct me if I'm wrong, because I'm not sure I'm saying this correctly. I think the normal dietary intake per person per day is how many milligrams of sodium? Do any of you guys know before I say it?
2,000.
I was going to say 1,200 moves, but I think you're right. I think it is 2,000. Thank you. So you want to look at the antacid and you want to see how many milligrams of sodium content are in it. Because if I've got congestive heart failure and I'm supposed to be on a low sodium diet, I'm probably not going to be taking any more than 1,000 milligrams of sodium a day. It's based on that conversation that I've had with my physician. So I'm going to look on the back of the antacid. The next time you guys buy an antacid, look on the back of it and see how much sodium is in it. You might be surprised. Okay? All right, so H2 antagonists, again, I'm just going to say 4 to 6 weeks is what your book says. Proton pump inhibitors, okay? Usually, people can take these for a lifetime. And proton pump inhibitors are called proton pump inhibitors because in your stomach you have what's called a proton pump, and that's what helps to make acid production. Okay, that's just kind of a simple explanation of it. So when we give you proton pump inhibitors, one of the most common ones that we give is omeprazole. It prevents more acid production. In other words, it slows that pump down, so it doesn't make quite as much acid. Now, the problem with that, and there's a lot of new research actually out there about this, is that that's not always a good thing. Like, our bodies make acid in our stomach for a reason. And so if we're continually causing our body to slow down the acid production, we can put ourselves at risk for a few things. One, sometimes, is there is a link between stomach cancer and proton pump inhibitors, believe it or not. And then the other thing is, if you take proton pump inhibitors, it can lead to problems with osteoporotic fractures. So it does something to the mineralization of the bones, and so it can cause people to be more at risk for fractures. So lots of things to think about, but it definitely is one of the mainstays of treatment today that we're using. So proton pump inhibitors, and you guys will see them. Protonics is the one I see used most often in the hospital.
When you have somebody that's post-op for a sleeve gastrectomy or a bypass, these are often prescribed. There's got to be a better way, though. I mean, because after time, if you have less of a need for stomach acid, wouldn't your body recognize that?
Yeah, we can try. We can try to wean people up. They shouldn't. I think the thing is they can be on it for a lifetime, but we don't want. And after surgery, too, same thing. But you know, the other thing is you have to think about what is the reason we're doing the gastric bypass surgery for. Because very often it's for gastric cancer, and very often it's for palliative reasons, and so we are going to continue to give them the proton pump inhibitors. Yeah, Kara.
Well, I know, like certain medications, like Nexium, in order to get that medication, you have to try the three other, like omeprazole, other ways to control your antacid before your insurance company will pay for that one. So whether that one's better for you than the other ones or not, it's harder to actually get that medication, and so I think that becomes a problem.
Yeah, so I think that's a
financially.
very good point, right? So sometimes what happens is You know, when patients go in to see their physician and they've got stomach problems, they don't start them out right away on a proton pump inhibitor. They'll start them out on an H2 antagonist because it's cheaper. So Zantac or Tagamet or something like that. You can actually buy those over the counter. And then maybe they'll move you up if it doesn't work. So you have to try it for 4 to 6 weeks, and then your doctor has to write in and say, nope, it didn't work. Same thing, you know, a while back, we had this huge, I remember 4 years ago, about 4 years ago, everybody was on Protonics. Everybody was on Protonics. Protonics is expensive, and it is one of those proton pump inhibitors that we use a lot in the hospital. And a lot of patients were on Protonics at home, and all of a sudden we were hearing from patients, oh my God, they won't give it to me anymore. I have to take omeprazole now, because it was a lot cheaper. And so insurance companies were refusing to pay for it. So we're going to also give antimicrobials because of the H. pylori bacteria issue. So those are some of the drug therapies. Now, notice this little note I have here. Watch out for sodium bicarbonate users. We have a generation of aging grandparents at home who know that bicarbonate, right, the baking soda, it's not baking soda, it's the, you guys gotta help me, the square yellow box. I did, it is baking. You were thinking baking things. All right. I'm thinking baking powder, you're right, got my brain. Okay, so everybody has baking soda in the house, right? And it is a natural tonic for some people, okay? And so much so that it is addictive, okay? But here's the problem. Bicarbonate. What's that tell you?
It makes you alcoholic, so it raises your pH.
Yes, you're both saying the same thing. It makes you alkalotic, right? So it raises your pH. So people can really get into serious trouble with alkalosis with sodium bicarbonate. They have no idea. They're taking tablespoons full of it, and they're like, it's making them really sick. So, Kara, so you gotta talk to people. You gotta talk to elderly folks about not using that. So when you're asking about medications and you're asking about what are you taking for your stomach to relieve the discomfort, you also want to ask about home remedies, because I'm telling you, people are really creative with home remedies, and it can get their body into a real whacked out situation. Kara?
I know vinegar has the same effect of kind of neutralizing your stomach acid to help with heartburn. Does that also contribute to the factors like the sodium bicarbonate does?
You know, Kara, I have to be honest with you, I don't know the answer to that question.
Okay, because I know that maybe that could be an addicting thing for people.
Yeah, I mean, it's a good question. I don't know.
Okay.
Yeah. I would imagine.
Well, because it's an acid itself, so.
Yeah. Okay, so here, I just want you guys to know about Zantac and Tagamet, right? You see them all the time. So they're also called ranitidine. Am I saying that right? Yeah. Ranitidine and cimetidine. Okay, so just H2 receptor antagonist smackdown. So we give it to alleviate the reduction of basal gastric acid release. And we want to watch for things like headache, diarrhea, and depression. I don't know that a lot of people understand this, but these medications can have some serious side effects in terms of psychological impacts, GI disturbances, and rash. Okay, and here's omeprazole, Prilosec. It's one of the most common ones that we give. Now, we give proton pump inhibitors, not just for peptic ulcer disease, okay, but we also give it for GERD. We give it for gastric ulcers, duodenal ulcers. We give it for severe esophagitis. And, you know, so we're going to, when people come in, again, complaining of stomach pain, I'm just repeating. You're going to check for H. pylori, right? The gold standard is the EGD. You want to ask them about their pain, what the location of their pain is, what the onset of their pain is. And we're going to treat it with medications that are either H2 antagonists, proton pump inhibitors, or we are definitely going to put you on some antibiotics. But again, here, Prilosec has some side effects. Fatigue, diarrhea, abdominal pain, and constipation. And once again, proton pump inhibitors, there's definitely some research out there linking it to nighttime use that can be directly correlated to stomach cancer. Okay. All right, so here it is again. I think I just said this. We want to try to use Prilosec first. We want to try the proton pump inhibitor first if we can. That's the preferred choice. However, insurance companies often say no, and you have to try the H2 receptor first. So Pepsid and Axid are usually the most common ones. And here's what Moses was talking about. Be really careful about overusing pumps because you're going to get this rebound effect. And then, again, we want to talk to patients about how to reduce their stress. You know, we're talking a lot about autoimmune disorders, you know, and so there is some component to this as well that can play a factor. Your body is attacking itself. Literally, that's what's happening. Even though we know H. pylori exists and it is one of the most common causes, some of the other research that we're learning more stuff about is that some of this is also related to some autoimmune disorders. Okay, so once again, perforation and hemorrhage. This is a repeat. I put this in here like 3 times. I must have been moving it around. Ignore this. We've already covered it. Oh my God.
The second one we get talk about a CDC or patient cross.
Okay. On the second one, thank you. All right. So way back where I thought it
The
was.
next one is.
Go forward, one more, right there. No,
One more.
right there.
Yes, right. I was right here. I was going to stop it. Okay. So again, I just want to reinforce emerging ABCs, right? Fluid volume replacement, large bore needle, labs. You're going to do a CBC right away. You got to get a complete blood count. You got to see what their H and H is at. Type and cross match means we're going to type and cross you for blood because we're probably going to have to give you a blood transfusion if you've got a GI bleed. And we're also going to do electrolytes because we want to see where your sodium and potassium levels are. We want to make sure that we are replacing fluids and not getting your electrolytes out of whack. So those are some of the, so I can just see, right, in my days in the ER, patient hits the door, it's a GI bleed, we're going to put lines in them, we're going to get labs, we're definitely going to get them type and cross matched. You know, the next thing is we might put an NG tube down, okay? So one of the things that you have to be really careful about when you're putting an NG tube down a patient who's got a GI bleed is not to make the GI bleed worse, right? I want you to think about those tubes, right? They're very, very, you know, it's that kind of hard plastic. So you have to be very careful when you're inserting NG tubes in patients with GI bleeds. And we sometimes will do what's called a gastric lavage, and we'll instill 200 to 300 milliliters of normal saline, and we'll repeat it, ice-cold saline, okay? We don't like to do this treatment because you can imagine that can cause some cardiac problems if we're doing that. But, you know, what do you do when you're bleeding a lot? What's one of the best things that you can do? You can get it really cold because it causes constriction of those blood vessels. And in your stomach, the lining of your stomach is rich with blood vessels. So we're going to instill 200 to 300 milliliters of ice saline, and we're going to repeat it, you know, like every 15 minutes usually until the bleeding stops, and we'll have the patient left sideline to do this process. It's one of those treatments that we did. Now, this is a slide. Sometimes we'll see patients come in with peritonitis, okay? So peritonitis is a hot belly, and it is going to require surgery. It usually means that you have a perforation. So you know that you hear people have ruptured appendix, right? So same concept, peritonitis. You've got the stomach that has caused perforation, and you've got stomach contents in the sac where it shouldn't be, so we got to get you into surgery because we got to get you cleaned out right away. So there's going to be rebound tenderness, the abdomen's going to be distended, it's going to be very rigid. We talk about it like a board-like abdomen. Very often they'll have a quick onset of a fever, well over 100 degrees,